Hi, everybody. So, today we're going to talk to you about tobacco and COVID 19 and how the two have benefited from each other. Now, it's weird to think that they have, but they have. They've definitely benefited from each other with the epidemic and the pandemic going on. So, the content in this slide is going to be up to date to July 2nd, 2020. Um, and we have links later on in the slides that will have up to date information to the time that you are seeing this. And those links are going to be later on in the slides, and they'll even have more information talking about tobacco and COVID 19. So, let's start off with an overview of the presentation so you know what we're fixing to get into. Starting off, we're going to give introductions of who we are, where we're from, and what we're about. Then we're going to talk about the who and the what. The who being COVID 19 and the impact that it's had, and the tobacco markets that are trying to use this as an advantage.
So the third point that we're going to hit is how COVID-19 and tobacco relate, and then to conclude the presentation, we are going to have a quick Q&A and also answer some frequently asked questions.
So, introductions. I'm Daegen Smith. I am heading into my senior year, so class of 2021. I'm from Shepherd, Texas, which is a small town north of Houston, about an hour north. I've been in the TA program for 2 years. I'm hopefully going on my third. And I've been in band for 7 years. And so this year I actually get to become my Shepherd High School drum major.
So hi, my name's Caraline Ott, and I'm going into my junior year of high school this year, and I'm from Tyler, Texas, East Texas, and this is my first year as a Say What teen ambassador, and I've loved every moment of being a TA. I love the people in this program, and overall it's just a really great program. A little about me is I'm a dancer, I do ballet, and I'm also on my school's drill team.
So the who and the what. So what is COVID 19 or the coronavirus? COVID 19 is a mild to severe respiratory illness that is caused by the coronavirus, which, COVID 19 being a small section of the coronavirus, it is highly transferable from respiratory droplets from like sneezing and coughing, and it can live up for a couple days on surfaces that have been introduced to it. Some of the most notable symptoms of the coronavirus is that of the fever and cough and shortness of breath, with some people reporting diarrhea and nausea, and there have been more symptoms that are coming to light with the coronavirus as more information is being released about it. And many countries across the world have started to quarantine their citizens to try to minimize the spread of the coronavirus. So I talked a little bit about the impacts in the last slide, but now I really want to dive into them. So what has been the true impact of COVID 19? Well, every state in the U.S. decided to close down their borders to try to minimize the effect that it was going to have. This caused their individual states' economies to suffer, and for basic everyday interactions to be switched to online. So, like this conference being online, we had to switch to doing that to help, support this healthy lifestyle away from the coronavirus. And the businesses that were left open, that were left, to do their business, was the ones that were deemed essentials. So stuff like grocery stores and clinics and restaurants. And their workers risk their lives every day traveling back and forth to be on the front of the coronavirus. Countries begin to restrict their travel internationally and mutually. The United States, Canada, and Mexico have closed down their borders to try to prevent the spread of the coronavirus from their sister countries. And lastly, the United States economy suffered tremendous losses during the early weeks of COVID 19, so around the early March time, with the stocks going as low as the 1929 stock market crash that caused Great Depression.
So you may be wondering how COVID-19 and tobacco relate. What do they have to do with each other? And there's actually a number of ways that they correspond, and I'm going to share a few of those different points. So the coronavirus actually attacks your lungs. So smoking and vaping is obviously not safe if you are scared about getting the coronavirus. And behaviors that harm the lungs are going to put you at a greater risk. So smoking anything actually increases the risk. That includes smoking marijuana or vaping or smoking cigarettes. And with vaping, the aerosol is what makes it so dangerous because when it enters your lungs, it harms your pulmonary cells, which are where the gas exchange takes place in your lungs. So overall, it's just not safe to be smoking or vaping anything, especially at this time because of the crucial health problems that can happen with your lungs and the virus going around. So before we had the pandemic of the coronavirus, we had an epidemic that was not talked about as much, and that epidemic is teen vaping. So kids were dying, and still are dying, and experiencing major lung injuries and damage due to this. And another thing is that right now, lung damage that kids had before the virus even broke out is now causing new problems with airway infections and lung problems. And so teens are more able to contract the coronavirus right now. And even though teens are deemed healthier and we don't really have as much to worry about, it's still, there's a lot of kids that are vaping, and that is something that is going to weaken your immune system. So if you want to learn a little bit more about this, I have 2 links right here. Healthline.com and drugwatch.com are where I got some of the facts from. And also, if you want to just double check the stats, I have that right there. So despite the dangers of smoking and vaping right now, Big Tobacco has still been managing to capitalize off of COVID with a lot of different tactics. They've been trying to seem like the good guys by promoting people to stay quarantined, or by making masks for their companies and giving out hand sanitizers. And a lot of companies have been doing like free giveaways with a box with like masks and their e-cigarette of their company. And another thing that's happening is a lot of incorrect health claims are being made, which I'm going to talk about a little bit in the next slide. And then there's so many more things happening. They're pushing online sales, they're giving out easier home deliveries, and therefore the home deliveries and the online sales are just making it easier to lie about age restrictions. And another thing is that tobacco products are being sold as essential, and they have been since the beginning. So these 3 ads you see right here, we have the one on the left that says a bitty stick a day keeps the pulmonologist away. So the pulmonologists, like I talked about earlier with your pulmonary cells, pulmonologists are doctors that focus on respiratory issues. And so obviously this is an incorrect health claim, and it's literally talking about nicotine at the top, and then it goes to say that this is good for your lungs and that you're going to keep the lung doctor away. And then this ad in the middle with the pink vapor surrounding the e-cigarette is promoting the free delivery that I was talking about. And then on the right you have a vapor company that is promoting quarantining and staying at home.
So, which big tobacco companies try to market off of COVID-19? Well, you have Philip Morris International, but they're better known as Altria. You have the British American Tobacco Company, and lastly you have Bitty Vapor LLC. But these are not the only ones, as many big tobacco markets have tried to use the coronavirus as an advantage to further their sales. So, do you want more information and you felt like, there's questions that you had that we didn't answer? Well, here are 5 different websites that each go to a specific link that has tobacco and COVID-19, and in each one of them you can find the most up-to-date information that we have, because some of them are from big organizations like the World Health Organization, the Center for Disease Control, or the Truth Initiative. So you can find up-to-date information regarding tobacco and COVID-19 through these links. So we don't have a vaccine to the coronavirus as of right now, but we do have a vaccine to big tobacco. The vaccine to the epidemic that big tobacco is furthering is education. Education is key to preventing youth and adults alike from using tobacco products that are going to harm them in the future. To say what is that vaccine, but not just the organization. Everybody that's involved, its members, its teen ambassadors, its staff, everybody is involved, even you, in this new vaccine against big tobacco. So we cannot control the coronavirus. We can try to prevent people from getting it. We can try to make sure that we stay healthy, but we cannot control the coronavirus. But we can control big tobacco corporations from plaguing our future generations with their harmful products.
All right, thank y'all so much for coming to our presentation. We hope you enjoyed it, and if you'd like to keep up with us more or see what we do outside of Say What, here are our social medias. We have our Facebook, Instagram, Snapchat, and TikToks at the bottom. And then also go ahead and follow Say What on all social medias. Pictured at the bottom, we have it's at TX Say What. We have TikTok, we got that recently. We have Instagram, Snapchat, Twitter, Facebook, and YouTube. So yeah, follow us all on that.
So here's some frequently asked questions that me and Caraline wanted to add in here because we've seen a lot of people asking them. So first off, are people with lung disease at a higher risk for contracting the coronavirus? The answer to that is yes. People with serious underlying health conditions, including lung disease, so for example, like COPD, asthma, lung cancer, cystic fibrosis, or pulmonary fibrosis, are not more likely to contract the infection, but they are more likely to have worse outcomes if they contract COVID 19.
So you may be wondering who else is considered at high risk right now. If you haven't heard a lot about it, they like to focus a lot on like the elderly and people with weakened immune system. That's who you know is at high risk of contracting COVID. And then people that are getting cancer treatment, or they've been smoking, or they have bone marrow or organ transplant, all those people are considered at high risk.
So if y'all have any questions, please feel free to put them in the chat box and I'll try to answer them as quickly as I can. So the chat box is open. So if y'all have any questions, put them in the chat box down below. And thank y'all.